Hey there, welcome everybody. Thanks for tuning in and joining us for this live broadcast. Josh Carey here, Pet Sittingology, and you guys are in for a wonderful, wonderful time spent with us. We are joined by one of my new favorite people, I must say, if I can be so bold to say that. Let's pull the camera in reverse and waste no time in introducing Dr. Andy Roark. How are you, sir?
I'm great. Thanks for hanging out at lunchtime today. Lunchtime Eastern time. But thanks a lot. This is going to be fun.
Yeah, it's funny because you do say lunchtime. Of course, you're in Greenville, South Carolina, the practicing veterinarian, the award-winning columnist for what's it called? DVM 360. We all know that site. Also, you are on the set of The Cone of Shame, which is like millions of views and all that nonsense. You're out in South Carolina. We do see in the chat box, for the record, everybody, thank you for joining us live. We see we have some people from the UK, from Germany, and of course, right here from the States. If you have any specific questions or comments as we get going, that is your area. We will address them. We are going to talk about not only subtle signs of pain that you can recognize as a pet care professional in the pets that you care for, which really is going to up your game, because the more that you make it clear you know how to recognize these subtle signs, it's going to do really good things for you. But we are going to begin right after these pleasantries. We are going to begin with using Dr. Roark's ear and stance as a practicing vet to see how in the world can we, as pet sitters, walkers, trainers, groomers, all sorts of pet care professionals, how can we partner with, associate ourselves with, affiliate with, get as the main referral source to vets in your area? That's what we're going to touch upon. First of all, before we get into that, give us a little background on what you're up to today, meaning these days, doctor. How do you spend your time?
Okay. Well, it's the summertime, and so lots of vets are traveling, taking vacation and stuff, and the clinics are just really full. And so I'm busy in the clinic a lot. Last month was just jammed to the walls all day. And so the clinic has really taken a lot of time over the summers, which is great. I love it. As it starts to calm down a little bit and the kids are starting to go back to school, I'm winding up for some Cone of Shame episodes. And so I'll be making my YouTube show again, which I love. And I'm on the road on the weekends. I go and talk to veterinarians about customer service for their practices and taking care of people and growing their practices and just delivering the best experience for people and pets possible. So I'll be in Savannah, Georgia this weekend, and then Kansas City next weekend. And shortly thereafter, I'll be headed up to Canada and just kicking around doing a lot of stuff. So I stay pretty busy.
And if I'm not mistaken, I believe in about 6 or 7 weeks, you will be in Las Vegas, Nevada. Do I lie?
No, you don't. It's man, it's coming up fast. But yeah, we've got Vegas, baby. And we're going to be talking about, again, pet sitting and growing our businesses there.
Yeah. If you didn't get that reference, Dr. Roark is one of our most recent additions to our keynote speaker lineup. He will be joining us live in Vegas for a full presentation all about sales and marketing and upping your game and growing your business and getting more clients and all that stuff. PetSittingLive.com is your place for still best pricing available, but the deadline is quickly approaching. I want to talk one thing as we get started here, Doctor, about the fact that Cone of Shame, for example, is content and it is videos and it is marketing. How do you find that that directly impacts your business as a business person?
Oh, sure. Okay. Well, so I'm one of those people, I really believe this. So if you run a business, the real measure of success for me is I want to do something that is meaningful to me, that makes me feel like I'm contributing to the world and I'm helping people. And if I can find a way to do that and feed my family, that's a win. And the idea that I get to sit in this goofy studio here and make videos that make me laugh and my friends, and we kick around jokes and we laugh and we have a good time, and I get to make this thing that I love, this art thing, and then I really make it thinking, how can I help pet owners? Like, what are they struggling with? What do they need? If I can make this thing and put it out and people use it and it helps their pets, that's awesome. And it's amazing. The other part is it's all about building relationships and knowing people. And nothing is more powerful than that, than video. And it's why I'm psyched to be doing this and be on the webinar. Is I want to see you guys. I want to talk to you guys. I want to be here for you. And I want to build a stronger relationship. And video does that better than anything else. I was just on Periscope, which I am bad at. I am way too old to be on Periscope. To be honest, there's a bunch of 14-year-old kids, and then there's me talking about osteoarthritis, and it makes no sense. But I'm there because I have a good time. And I think that somebody out there will find me and they will stumble on, and their pet will be struggling to go up and down the stairs, and I can help them and I can help their pet. And so I do it. And that's why I do Cone of Shame. That's why I love it.
I love that. And if you can't tell, Dr. Andy and I have had many phone conversations. And like this, I feel like we both speak a mile a minute. And it's really because we're passionate, we're excited, and we're really trying to just jam in as much as we can into this session. And yesterday, when we were sort of finalizing the details of this video chat together, he said, you know what? We'll make it great. And if we have to do another one because we have so much information, we will. So that was planted in my head that I'm just excited for that. But let's focus on this for a minute. I love that you said build relationships, because I wanted to get your specific and personal opinion on your practicing vet. I always talk to my industry and audience about finding the right way and the best way to associate yourself with a vet in your area, because that can do good things. That can help you become a referral source. That can help you build your marketing efforts, legitimize yourself, all that stuff. What is our best game plan? How do you relate to pet sitters? How do you view pet sitters from your vet standpoint? And how can we get into your world?
Okay. So the first thing I always tell people when you're talking about how do I work with vets and sort of get in there and get into that world, listen, understand the priorities of veterinarians. And I think these are exactly the priorities for vet technicians and anyone you're going to come into contact with in the practice. It's probably the priorities for most pet sitters, but they're different from most of the population. Here are the top 3 priorities. Number 1 is pets. Pets are number 1. The welfare of pets are the number 1 thing that most vet professionals care about. Number 2 is people behind pets, like meaning how do we deal with people? How do we keep them happy? And number 3 is profit or income. So that's third place after taking great care of people and taking great care of pets. And so anytime you want to go and deal effectively with vets or vet teams, remember those 3 things and go in and know that it's about the pet. First and foremost, it's about taking the best care possible of pets. And then ask the right questions. And so what I mean is, if you walk into a vet clinic, you act like, hey, look, I know what I'm doing, just send people to me and it's going to be great. They're not going to buy it. They're not going to go for it. The questions to ask are things like, hey, how do you handle boarding? What do you do when you have pets that people really don't want to board them here at the clinic? Do you outsource? Do you have pet sitters that you recommend or evaluate? And ask those types of questions. If you can make it so that the pets that go to that clinic are getting great care and the veterinarians feel comfortable referring, that's a good thing. When I'm in the exam room and I'm talking to somebody and I'm dealing with this client that I've known for 10 years and I love them, and they say, you know, Dr. Andy, I think we're going to keep, Muffin at home when we go and travel. Do you have anybody you recommend? I want to give them a good recommendation. I want to give them someone that I know that I can say, look, this person, Sally, comes in and I've used her for my own pets when I've traveled, or I have referred her to a number of other clients and they've had great experiences. That makes me more valuable. And so that's the win that we're looking for, is how do we help the vet so that they feel good and they feel supported, and then that also helps me. And most of all, it helps the pets, because the pets are now with somebody who's going to take great care of them, and this is someone who's going to be very attentive, and that's what we're going to get into later on.
This is phenomenal. So let me recap just a minute so we can get the specifics tangibles. So some of the things I heard, doctor, was that, which makes complete sense, you, just like every other vet, wants nothing more than a solid relationship, which should help alleviate some fear. If fear, going into this, maybe the fear of rejection, maybe the fear of the unknown, but remember, the vet desperately wants to be in touch with a phenomenal pet care professional who they can say, talk to Cindy, she's wonderful. So to do that, you have to go in with the right mind frame. You have to be confident, you have to be knowledgeable, and you have to ask the right questions. I love that you said ask the right questions. Don't just say, hey, I'm new in town, here are some cookies, or here are some business cards, here are some pens, can you refer to me? That's not really the best approach, right? What you want to do, as you pointed out, is ask the right questions. Hey, how do you handle pets in this situation? Because one of my clients happened to be in the same situation, and I'd like to be able to refer her to a relevant and valuable vet in the industry. Also, Dr. Andy, is it appropriate for me to come into your office as a relatively unknown newcomer to the area, or just trying to establish a relationship, with these questions, with this attitude, and say, you know what, I'd love to not only recommend you, but feature you on my blog with a piece of content? Can I ask you just a few questions, jot down your answers, and publish it? Does something like that work?
No, oh, that's fantastic. That I love that. That's really bringing something to the table right off the bat. And so the way that veterinarians see this, if they're savvy, is that they go, wow, this person is willing to do the work. That's one thing. If you say, hey, would you write something and I'll publish it? I'm not a writer, I'm a vet, I might not be interested in that. But if you say, I'd like to interview you for a blog, heck yes, that's wonderful. And we all know none of us are good at bragging about ourselves. We're generally a humble people that, again, we work with pets. That's what we do. We're not big ego people. And so we're really bad at talking about ourselves. And so if you'll come in and you interview, and like take this for example, like Josh is going, oh, Andy's great, and my head is swelling, and I appreciate that. I'm not going to say it. I'm not going to do those sorts of things. But it means a lot to me that he thinks that and he would say that. It's the same thing. We walk in and say, hey, can I interview you? I want to learn more about your practice. I'd like to put it on my blog. I can then, if I'm smart, share your blog on my Facebook page, and that's great for you. It's great for me. But those are the things where you come in and you're bringing value to the practice, not saying, hey, I'm asking you a question. Can you send me business because my kid wants some new Nikes and it's not in the family budget? That's not how I get in the door. You're bringing something to the table. You're bringing great pet care, which they care about a lot, and you're offering them, hey, can I help promote your practice? This is their baby. They pour their heart and soul into this little practice, and you're helping them with that. You become a partner when you do that, and we all could use some more partners.
Yeah, and it feels like we could talk about this specific thing forever, perhaps in an upcoming hangout where we talk about how can the pet care professional get into your good graces. Here are some of the ideas we have. We run them by you, but that could be because I do want to get to some of these. We can always double back. If anybody watching has specific questions or comments on this, do let us know. But that is wonderful to know that, yeah, you want a fantastic referral to a pet sitter or dog walker for your clients. And the way to do it is to bring value to the table. Don't just ask for something in return, give something first. All the standard rules apply, right?
Right.
Yeah, good. Okay, so let's get to the secret signs of pain in pets and what you can do about them. Because what I said at the top of the show was, if you know all of this stuff, this has to up your game if you use it properly. Because, for example, everyone who follows me knows that I'm a relatively new dad. I have a 2-year-old and a 2-month-old at home. So I'm a new parent, right? And love every minute of it. And what we would always look for in a babysitter, aside from a referral, hey, who knows who can help us? If the babysitter has CPR and first aid and they understand and they can recognize, is the baby tired? Is there something more serious? Doesn't that make sense? Of course it does. The same exact thing has to go to the pets we care for. The pet parent wants to know, and can you imagine if and when she does know that the person she's interviewing, that the person she's ready to hire says, I can recognize weird, subtle signs, even at the meet and greet. If you notice your dog's a little obese, and we'll talk about ways to present it, but if you are aware what's happening while you are caring for this pet, oh my goodness, you can use it to your advantage. So let's get to some of these signs.
Sure.
You talk about one of them. The first one we'll talk about is a funky hair coat. What can we learn about the coat of a pet?
Okay, so yeah, let's jump in and talk about this. So when we talk about subtle signs, the obvious signs are pets crying, limping, things like that anybody would notice. Let's go a step beyond that, because honestly, most pets, when they're in pain, they're not crying, they're not limping. They're hiding, they're hiding the pain. And the other thing is, think about us, right? When was the last time you hurt yourself and you cried about it? And you cried for days, like, oh, my back. It's awful, and you suck it up and you go on, but that doesn't mean it doesn't hurt. And so I'm looking for signs like that. Now, funky hair coat. What I'm talking about is like that mohawk that you see down the back, definitely down the back end. It's the back half, the back end, and it's just kind of funky. And in long-haired cats or dogs, then you may see mats. You may just see greasy, oily stuff. Think about those pets you've seen where they just seem to have like an oil spot on their back end. That's not some funky glandular thing. They're not cleaning. And so why is that? And that's what I always want to know. There's two big reasons that I see this, okay? So when you're looking at those pets and you're seeing this spot on the back end, it's a different hair coat, it's a funky hair coat, it's matted, whatever, there's two reasons, okay? Number one is it's pain. And what that means is we've got neck pain, we've got back pain, we're not being able to turn and groom the way that we should. Everything else is getting groomed, but I just can't turn my neck that much further, and it hurts. And so I'm looking for signs like that. So that's number one, is pain for the funky hair coat. The other one is obesity. And there'll be some pets that will be so obese, they simply can't reach. They're not in pain, they just can't get back there. But especially if you've got a skinnier animal, I wonder why. Is it neck pain? Is it back pain? And those are the types of things that they're not going to cry. They're not going to be holding up their legs. The owners might not even know that their pet is in pain. But that's usually one of the first signs. And then we start to look for some others to kind of back up the idea that this pet may not be comfortable. This may be a pet we have to pay special attention to.
Right. Now, I'm going to ask you this question because I'm sure it's the same for us as pet care professionals when we're in the presence of the pet and the parent. Yeah. If somebody brings a pet into you for an unrelated reason, but you happen to see this funky hair coat, and how do you broach the subject instead of saying your dog looks filthy, what's going on?
Excellent. Really good question. Okay. So what I always, I teach my technicians, I teach other doctors when I go out and talk about this. When I've got something like this that I'm wondering about, I don't want to come at you just like you said, like, hey, your dog looks really funky. Are you not paying attention to your dog? Like that, yeah, that's not going to fly. They're not going to buy into that. They're going to shut down. They're not going to hear me, and I'm not going to be able to help them or their pet. And so I'm going to ask follow-up questions like, when did his coat start to look like that? And then I'm going to ask some other questions, which we'll talk about some of our other signs. I'm looking for supporting signs, and I'll ask questions like, does he get around pretty well? Does he get up on the couch? Does he go up and down the stairs? Things like that. And I'm going to fish a little bit, and I'll wait a little bit. And what I'm doing is I'm collecting information. The other thing is by asking these questions, I can oftentimes make the pet owner understand where I'm going when I don't even have to say it. And they go, oh, you're right. There are a number of things that, that have sort of changed with him. Maybe we should get that checked out. Yeah. Wow. Yeah. Yes, maybe you should. That would be awesome.
Right. So if we are either on the initial consultation or coming across the pet during one of our routine visits, we could ask the parent, does his coat always look like that? Or how long has his coat looked like that? That's the good question.
Oh, I mean, yeah, exactly. Just fish a little bit and kind of ask the open-ended questions. Don't ask yes or no answer questions. Ask like, tell me about this, or how long has that been going on, or when did you see this, or what is that like? Yeah. And just let them talk and see what you learn. And a lot of times, they'll kind of catch the drift of kind of where you're going, and they may have an epiphany themselves. They may just have this sort of mental explosion and go, oh my gosh, you know what? When I get back, I'm gonna get him checked out, or maybe, you know, maybe while I'm gone, maybe you could run him by the vet. That would be
right. And what's amazing about this is that while we are learning to recognize subtle signs of pain in pets, it's not about, and we're going to touch this later, about some additional ways, non-medicating ways that you can treat and handle the pain. But fishing like this is not, the end result isn't so you can help and fix it medically or to prevent a vet visit. It's for that. It's for the owner, the pet parent, to be aware and say, you know, my goodness, maybe I do need to bring him to the vet. It's to spark that realization, right?
Again, it's the synergy of the vet and the pet sitter working together. Because what I want is this. I do want to bring it to their attention so that hopefully we can go to the vet and we can get them on some medications or some things that are big guns that I can't do with a pet sitter. But it's also going to impact how I take care of this pet when they're gone, and it lets me show real value. If I start to say to them, hey, look, I've added some extra bedding, I've done some other things to make sure that we have really good comfort here. You know, we did some hot packs on his lower back because that's kind of where he seemed to be sort of uncomfortable. And you know, I've done a course in animal massage, which is fantastic. If you have been, you need to be talking about that. If you haven't done it, it's something to maybe add to your wish list of things you might get to do. But seriously, some myofascial massage, some general basic massage, some passive range of motion, joint manipulation. These are things you can do, and they bring a lot of value, and pet owners are really wowed and impressed by them. And when you're having this conversation, you're highlighting the value of your expertise. I mean, you're the real deal. You're paying attention. You're bringing these services that other people don't. And ultimately, this pet's going to end up at the vet. And the best thing in the world is not just for them to go to the vet. It's for them to go to the vet, get on a pain medication or something that's going to help them, and then still have these adjunct therapies which you provide at home, which is, again, the hot packs, the massage, the extra bedding, the comfort, the stress reducers, all those sorts of things that we'll hopefully get into in a little bit.
Yeah.
You bring those things to bear. That's extra value that you bring. That makes me as a pet owner feel fantastic about leaving my pet with you.
Exactly. And it's really about extra value and just that sort of upping your game and making you the easy preferred pet care professional. Before we get to the second sign of subtle pain or subtle sign of pain in pets, Laura Capra brings up a fantastic way that she acknowledges something like this. But before we do, which will bump us to number 2, I just want to ask everybody joining us live, are you digging this? Are you loving it? Are you liking it? Are you getting value? Are you interested? Are you with us? Type yes if you are into the chat box. Let us know. And also, my goodness, if you like this and you want to see more and hear and meet and see and feel Dr. Roark in person, right? Come on to Vegas. PetSittingLive.com is your ticket. He's going to be there. I'm going to be there. And hopefully we will see you there. What Laura said about how to bring it up to the pet owner, she says, I bring it up by saying, I noticed that this wasn't normal behavior and wanted to bring it to your attention. So that sort of puts the defense away.
Oh, I love that. And Laura made another comment that I saw scroll by that I really liked as well, which is you're bringing fresh eyes into the house and looking at the pet. And for them, they see the pet every day. And that's what we see a lot with senior pets. So just something else, a little tip to be aware of. I see my dog every day. The fact that he's got, less and less muscle mass in his back legs, I may not notice that because I look at him every single day. We see it in people too. You see your grandmother and then you go away and then you come back and you go, oh my gosh, she shrank a foot. That's the same idea. That's the same idea that we have in people. But when we're with grandma every day, we don't really notice that because time passes slowly and we see these people. I don't understand why we're talking about grandma. I don't know where they came from.
Exactly. Right. And why doesn't she know that she shrunk a foot? No, I didn't. No, grandma, you're now 3.5 feet. I don't understand. She doesn't get it.
But you get the idea. When we're around pets every day, there are slow, subtle changes in their abilities, in their mobility, in their comfort level, in their habits. And we don't see them because it's not like, oh, suddenly today I have arthritis and I can't go up the stairs. This is a very slow, progressive process. And so coming in from the outside, right off the bat, you have the ability to really help this pet.
Yeah, and thank you everybody for commenting that you are loving this. Right on. Let me scroll back to something that our friend Mary Page had said. Listen to this, doctor. She says, we offer a wellness assessment, no charge, at pet sittings or off or after we have not seen a pet for a while. It's a snout to tail assessment learned at Pet Tech, pet first aid and CPR, which, by the way, is our producing partner at our conference. So don't miss that. Do you think that this is overstepping with the client? Mary Page wants to know about offering this snout to tail assessment.
No, I don't. I actually really like it. And that was one of the points I kind of want to make today. So I'm really glad you brought it up, Mary. The way I see it is this. You know when you go and rent a car and they give you that sheet and it's got the car, like the little drawing of the car? It's your responsibility to walk around the car and say, oh, this is how I received the car into my care. You know what I mean? If there's anything going on with the car, you're supposed to tell them up front before you leave the car. As a pet sitter, there are some parallels there. And what that means is, you're taking this pet into your care. And you see it all the time. The pet it has a little limp, and the pet owners, they don't say anything about it, and they go away, and they come back and they go, oh my gosh, where's this limp coming from? And you say, well, you had a little limp when I got here, and it's sort of the same. For whatever reason, they didn't see it or they didn't notice it or whatever, but now that they're coming back, they're the ones with the fresh eyes, and they're seeing this. So just taking the pet and just doing a visual assessment and sort of walking through all their needs and what you're seeing, I think that's a smart move. It gets them to look at their pet. It shows another level of commitment on your part. You're paying attention. And then it covers your bases. So when they come back, or if something happens along the way, you could say, hey, we talked about this, before I left. I'm afraid this is getting worse. I think that maybe it's time to go see the vet. Or, hey, this is getting worse. I wanted to bring it to your attention. So I really like something like that. Just think about your wording about how you're going to present it. I like the
wellness assessment. Yeah.
And also, if you do something on paper and you give it to them, you put it into their hands, they've got something, again, to sort of show the value of what they got for their money while they were out of town and you were there taking care of their pets. It's a reminder of the type of work that you do and the level of care and attention that you provide to the pet. So I don't think you're overstepping at all. I think it's really good. And just present it in the right way as, I do this for all of my pets. It's a standard service, and it's just something that I think is important before people go out of town.
Yeah, that's fantastic. Mary Page says, thanks for that perspective. And certainly, if anybody has a question or comment or thought for Dr. Andy Roark, please do put it in here. We will certainly relay it and discuss it. Kristen wrote, I just finished with an overnight client, and her dog was shaking his ears, and I looked inside, and they were red. I spoke to the owner, and she directed me to her ear wash for him. The next day, he was not shaking his head anymore, and his ears were not red. So that is a way that you have acknowledged and satisfied, because who knows where that could have led, right? That could have progressed much worse.
Well, and here's your opportunity. You're coming in, you're about to take the dog into your care. You notice he's shaking his ears. I don't want to sit and watch this poor dog shake his head for a week. That's awful for him, and it's awful for me. It breaks my heart. So yeah, just say something up front. And she said, hey, I've got some medication and I've got something that we're already treating with. That's good that we can go ahead and do something. It may be that she doesn't. And then she says, hey, well, let's get him over to the vet. And then you're providing additional service. And if you don't have maybe an extra charge or a package or something for dispensing medications, you take that dog in and you say, hey, I'm going to do ear medicines. You may include that into your services. If you do, say so, because that's a value-added thing that you're bringing to the table. If it's an additional charge, you say, hey, up front, these are the things, and maybe put it if you have a pricing schedule or a brochure or something like that. Because one, you're saying if there's this extra work, then there's a charge for it, and people know that. But number two, you're saying, I'm willing to do this work.
Wow. Yeah.
They're gonna see that as the best thing ever.
And it just popped into my head. It would be amazing to even, instead of being asked to work this in, and I see that some people have said that they do a version of this, but during the initial phone chat or email, or even in the first initial face-to-face, why not make it clear to them, I am proficient, whatever the comfortable word you're going to use, I'm relatively proficient at recognizing subtle signs of pain in your pets, whether it's a funky hair coat or this or that, all the other things we're going to learn. And should anything become necessary, I'm going to bring it to your attention. And if for whatever reason I have to administer medication, it's not included or it is included, or so you don't ever have to worry about it. But like you said, it's value add. And that's the way. Say, hey, by the way, just so you know, I'm able to recognize a dozen different subtle ways so you can go off and do what you're doing, go on vacation or go to work every day. I'm going to keep a keen eye on that pet to make sure that X, Y, and Z isn't happening. But if it does, I'm going to let you know, and I'm going to take this action, and you're going to be in good hands. Who doesn't want to hire that person?
Right. Well, I think you can roll it into the initial health assessment as well. I mean, I think all that stuff can come together. It's a package you can sort of work on and work on your delivery, and it's something that you give to every single client. And it's just, I think it can be a real game changer.
Yeah. Let's talk about the second subtle sign, which is getting grumpy or not acting the way the pet usually does. Are you suggesting, Dr. Andy, that grumpy cat is in pain constantly?
Grumpy cat he may have some facial pain. I'm not sure. No, so I see this all the time. And listen, age is just a number. It really is. If the pet is changing their behavior, it's not because of their age. They're not fretting about, oh my gosh, I'm 10 in dog years. Oh, it's killing me. Like, that's not the thought that's in their mind.
It's in my mind, though.
It's in my mind, totally. Like, oh man, I'm almost 6 in dog years or what. So,
right.
Anyway, that's not the thought that's in their mind. If their behavior is changing, there is a physical reason for it. And I'll see this, and the most common times I see it, really honestly, is when people are in the exactly spot you're in, Josh, where you've got young kids. And it's because, we've got this older pet, and you and I are going to be gentle and ginger just naturally because we're dealing with an older pet. But kids don't have that level of understanding. And so they run up and they're patting maybe a little bit too hard, or they're trying to give hugs. And we see dogs that will bark or snap or growl or move away, just, leave the room when the kids come in. And people go, oh, he's just old and grumpy. Honestly, he's probably sore or stiff, or he's worried about being hurt. And that's why this behavior is changing. So if you start to see behavioral changes like that, pay attention to that. I had one case in particular, and it was a dog that was starting to snap at the children. And this was really upsetting to the family, as you can imagine. And what ultimately ended up happening was he had this significant pain in his neck. He had a slipped disc in his neck. They were able to take the dog to the vet and get it surgically repaired. So he had this a procedure done to release the pressure in this disc space. And that dog became a wonderful, loving dog again. They actually took it and turned it back the other way by recognizing that this was a pain response that we were seeing, and then figuring out what it was and then fixing it. And so, yeah, changes in behavior like that, I wonder why.
Yeah, and speaking of changes, I want to move to number 3. And I would love for you to focus on cats in this regard. A, because I know that it's very, very serious. And B, because I promised our community we would include cats into this whole conversation. That's for you, Rita. Go ahead, doctor, please.
All right.
It's about breathing changes, right?
Right. Absolutely. So breathing changes. So with cats, that hair coat trick that we talked about at first, number 1, that's almost your best bet, I think. I see the most, funky hair coats on cats, and that's really one of the key signs that I see. So good point about the cats. With breathing changes, one of the key indicators of pain is respiratory rate. And so when pets hurt, they breathe quicker, all the way up to panting. And you've seen dogs panting. And if you've ever spent time around a vet clinic, you'll see dogs that wake up from surgery, they pant. That's a sign of significant pain. If I'm watching these pets and I see them and they're coming out of surgery and they're panting, I need to do something more for that pet's pain. It's the same thing at home. I'm going to look for panting, but that's significant pain. But when we dial it down, this is where the subtlety comes in. That's still pain. If you've got a pet that's just constantly breathing at a higher rate than what you consider to be normal, I wonder about that. If I have a pet that jumps up onto the couch and then breathes heavily, I wonder if that's not lagging pain. Why is this particularly important to cats? Well, cats are more secretive. One of the things that we can do is we can observe them from across the room, and we can watch that respiratory rate. And I can watch how they're breathing, and I can say, does this cat look comfortable, Or are we breathing too quickly? Are we breathing more quickly than I would expect, you know, a cat this age to be breathing? Or I saw this cat before and I've never noticed this type of change before. The other thing is this. If you see a cat panting, that's not like a dog panting. That's bad news. Grab that cat and go to the vet. And it can be pain, but generally cats do not handle respiratory stress very well. A panting cat is a dead on right this second emergency. Grab them and go. And so just be aware of that with panting cats.
Wow. Phenomenal advice. And I'd love to hear your take on this. Tess asks a great question. What is the best way to handle a client who resists taking pet to the vet? The ones that say, oh, he's just getting old.
All right. Yeah, so there's a couple of different things. You know, what I usually say whenever I'm having these conversations, and they can be sort of tricky conversations, okay? What I often do is a couple of things. You know, I ask those questions, those open-ended questions. I mention some different things that I'm seeing, just kind of passively over the course of our initial conversation. Put them sort of in that person's mind. If they say, well, you know, I don't want to do this, or they can be kind of resistant. I call it my Moses example. And I talk about Moses going to the Pharaoh and saying, letting my people go. And I'm not getting super biblical here. Don't stay with me. But we're going to bring down the plagues, you know, if this person doesn't comply. In the Bible, God didn't start with the 8th plague or the 9th plague or the 10th plague. He started with the first plague. And then we move up from there. And it's the same thing with these conversations. Is I want this person to take their pet to the vet. I'm going to start with very small suggestions. I'm going to ask questions. And then maybe as things come up, I may mention it again, you know, but I'm not going to jump in guns blazing the first time and say, well, listen, you've got to do this. Let's see how it goes. I'm going to do what I can. I'm going to, when I write up my report, I am going to make mention of the specific things that I see and say, these are the reasons why, you know, a pain assessment at the veterinarian can be beneficial. So I'm putting it down. I'm giving them something. I'm not beating them over the head with it. The other thing, and this is really key, people respond to stories really well. And so a lot of people, when they say, you know, I don't really want to go to the vet, there's probably a deeper reason why. And we say, well, they don't want to spend the money. Well, they're bringing in a pet sitter. They're doing some things that are right. They're doing things that are good. And, you know, that's an assumption on our part. And sometimes it's a flawed assumption. And so it may be that they go, you know, I don't think this is going to work, or I don't think that that they're going to have anything that will help, or I've tried other things before. If you have some experiences or stories, you say, you know, I had another client that I went and saw, and they had something similar, and they went to the vet, and this is what happened, and it's been really great. You can just leave it at that, and you're sort of planting a seed and letting them know there is hope and there are things that they can do. But try a couple of different ways. Just don't start out going hardcore, because what may happen is you end up putting up a barrier between yourself and that client, and they're not going to hear what you're saying. So we have to work subtly, and sometimes it takes time to get where we need to go. You can do what you can do, and so the fact that they've contacted you is the first thing that's great, and we're going to do everything we can for the pet. But let's have those conversations. Let's maybe leave a written assessment at the end saying, hey, this is how things went, and these are some of the things that I noticed, and you know, that's sort of why I make this recommendation. I'm going to maybe tell a story along the way, if I can, of somebody else who's had great success, and try to go from there. So those are the things that I start to do to try to move them towards, you know, complying with medical care.
Fantastic advice. And Jay, it is great to see you here. And I know you are. He says, hey, Josh, I am a cat person too. We love cat people. Good to see you and have you here. Deanna writes, there are some clients who tried to avoid giving any meds or minor grooming tasks to the pet sitter. I prefer to establish a relationship that includes open communication about all health issues. And I think that that's what you're saying, doctor, just to slowly but surely introduce it, get them comfortable talking to you and listening to you, and eventually they should see the light, right?
And Jess is 100% right. What I really want is I want a long-term relationship with this person. I want to build trust, and that takes time. But ultimately, I want to get to a point where this person knows me and they know my experience level, and they think highly of me and my opinion and what I'm saying. And when I say, hey, look, it's time to go to the vet, I think so. This is not the first time we're meeting. You've known me for 5 years, and you know that I know what I'm talking about, and you'll go, okay. But I can't do that necessarily on the first day. And that's what I was talking about, the importance of not throwing up barriers. It may take some time to get through to this person and build that relationship and build that trust. But that's the ultimate goal. And that's the real value for pets, of having a long-term pet sitter that comes to them and knows their behavior. We go back to the second point we were talking about with the respiratory rate. That's a thing that you know because you're familiar with this pet and you've seen them for the last couple of years, and now this doesn't look right. And that's when the fresh eyes really come in, is because you say, I saw this pet 2 months ago and they didn't look like this, or they didn't act this way. And so the value of a long-term relationship is really important.
And this stands reiteration. You said people respond to stories, and Peaches writes, I was just going to say share a story, because it really makes sense. I mean, story is at the foundation of really the human existence. If you trace it back, you'll see story is at the heart of everything we do practically 24/7. So yes, as a pet care professional, you are living and breathing the life and your business. You have stories, you've seen it all. So see what you can relate, like Dr. Andy suggested, and just have some back pocket stories like, I've seen this before. This is what happened, and this was the result. Works wonderfully. The next secret sign I want to get to is about being restless. And doctor, if you don't mind, I want you to specifically focus on how to keep them comfortable in a supportive bed, as you say. And I'd love to hear what your ideal situation and material and mattress and all these goodies for keeping them comfortable look like, please.
Right. Okay. Great question. So yeah. So restlessness. This is the pets just not sleeping very well. It's them getting up and pacing around and leaving and coming back and laying down. And a lot of that time is something associated with, these are probably old pets. They may be arthritic pets. They may be thin pets where they're, they've got sort of bony knees and bony hips and they're laying on the ground. And a lot of times I've got a 12-year-old dog sleeping in a 12-year-old dog bed, and you see that. And it's again, the owners see it every day. They just don't think about it. And so again, think about how I would want my grandma, to sleep. If I'm making a bed for her, like padding. I want to have these things. There are some of the beds that I like out there. You're seeing more and more of these supportive, like Sealy Posturepedic style beds that can be really great and really beneficial. But you don't have to go that way. I mean, you can go, I use extra blankets. I'm going to build them up, pile them up. Honestly, sometimes it's time just to mention, hey, I noticed that bed was pretty beaten down. He's an old boy. I've seen some people have, really great results when they swap out for a new bed. So I'm going to do things like that, just to try to keep them comfortable. I may move the bed up onto the couch or something like that if that's allowed. But the big thing for me is I want a lot of padding in my senior pets. I really do. Most older pets are sleeping on beds that are too thin for them.
Rita writes, since cats hide their illnesses so well, it is important that we communicate to clients that we are aware of what to look for. And I share with prospective clients specific situations where we spotted issues and got cats to the vet in time to save them. That's no joke.
Well, again, and go back to cats, the fresh eyes. We talk about weight loss, for example. Senior cats losing weight. There are a lot of different reasons that happens, and not many of them are good. And so these are the things, we pay attention to the cats from afar. Those things can save lives. And so you're exactly right. And noting those signs and symptoms of things that we're looking for, that's a big thing. And we all know that cats aren't getting to the vet as often as they should. I'm sorry, getting on my vet soapbox for a second, because this is something I'm passionate about, especially indoor cats. People say, well, he doesn't go outside, he doesn't do anything. And we start to miss some of those chronic diseases like hyperthyroidism, like kidney disease, urinary tract infections, diabetes. We start to miss things like that. We catch these things later in the game. If we'd seen them earlier, treatment would not be so intensive. It wouldn't be so expensive. It wouldn't be so hard to do. And the cat would have a happier, longer lifespan.
Yeah. Speaking of, let's move to the next sign. You talk about house training accidents. How does this tie in?
Right. So very similar. House training accidents. People will say, well, she's just old, and so she's having accidents now. This is true, especially, let's go back to cats again. Cats start peeing outside the litter box. Not every time, but sometimes, and people go, well, she's just getting grumpy in her old age, so she's not getting in there. That's probably not true. older pets can get urinary tract infections, and we see that just like old people are more prone to. Old pets are. Their immune system isn't what it used to be. So I do see some of that. But the other things that we see are pain and arthritis and hip dysplasia and things like that. It prevents, for cats, it can prevent getting into the old litter box. You know, you think about it, you know, if this was us and we were getting into a litter box, the wall of that litter box may be waist high. And I'm asking grandmom to climb over this waist high wall into the, you know, into the bathroom. She just didn't want to do it. And they don't blame her. The same thing even with dogs. And once cats are in the litter box, they have to get in a certain posture that they're used to. And then so they start to squat down and do that. But man, you'll see the poor old dogs and they're, you know, they don't have any muscle in those back legs and their knees are just bobbing, you know, and shaking and their little hips just look pitiful. They don't want to get in that posture. And so they go outside and they resist. They just go, oh, I don't want to do this. And before you know it, the assigned time for potty break is over and they've gone back in. And finally, they just can't hold it anymore. And it's the saddest thing ever. But people don't think, oh my gosh, maybe my cat's hips are bothering her to the point that she's just not getting in the box and going until she absolutely can't stand not to. And so that's something I always bring up when I start having pets with accidents, especially senior pets. I'm thinking about it. Other pets like Dachshunds, you know, our guys, I love the Dachshunds, but we know they're prone to back injury. We know that there's something we got to look out for. And they'll jump off the couch and they'll yelp and then they'll start having accidents in the house. That's because they have a painful lower back, because they have a little bit of a disc problem going on of some sort to some degree of severity. But owners will miss it and they think that the pet's just being ornery.
Wow. Everybody joining us right now, are you like me? Do you feel like you can just watch and listen to him speak all day? Because I can. Dr. Roark, will you get one of those cameras that just sit on your head and we can just broadcast and chat with you as you go about your day? Seriously, this is amazing. I feel like we're barely underway and I feel like we could go on and on and on. So thank you for being here and doing what you do. Again, I'm going to remind everybody, if you love what we're doing here, you're going to love seeing us in Vegas. Dr. Roark is going to be there talking about incredible stuff. I'm going to be there, and hopefully you and your colleagues will be there as well. PetSittingLive.com is the place. Before we get too far ahead of the game, because my goodness, the top of the next hour is quickly approaching, I want to get into some tips for pain management without drugs. But first, I want to comment on what Elaine wrote. For you, doctor, she has the question, what do you do when the dog doesn't want to sleep in the bed anymore, just on the hardwood floor?
Oh, that's a good question. Yeah. If you know, that's a tricky one. It's hard to know what's going on in the mind of the dog. Sometimes, yeah, it's their personal preference. A lot of times what I'll try to do is say, well, why is this happening? Is the bed too lumpy? Is it something like that? Sometimes I'll try to sort of provide a, just a blanket, something like that. Some of the firmer dog beds may solve the problem. I said, like, I mentioned the Sealy Posturepedic one earlier. I'm not trying to sell you a Sealy Posturepedic bed, but they are pretty firm. Things like that can help. In other cases, what I'll say is, well, that's where he chooses to sleep. And I've seen lots of people buy wonderful, really expensive dog beds and watch the dog sleep next to them. And so that can happen as well. The big thing I just sort of want to pay attention, is this a comfort thing? Is he just not happy with the other bed? I might try another bed out and just see if I can make a difference. But honestly, for some dogs are weird. It may also be a coolness thing. It may be, especially in a longer haired dog, and they get in there and there's blankets and things and they just get too hot. And so just laying on the hardwood is nice and cool. So think about that. It may be a thermoregulation thing. Maybe we're trying to be cooler.
Yeah, and guys and gals, in all honesty, we have a whole list of things that we just can't possibly get to in the limited time we have today. So a few things. We may schedule one of these in the near future and bring him back on for everybody. We may pull him into our groups and hound him with additional questions. But at the very least... what we're going to do is we're going to take this recording and we're going to put all of this that we didn't get to. So if we don't banter about it here, we're going to get to all of the signs, all of the tips for pain management, additional ways of dealing with pain. So look forward to that. But on that front, tips for pain management without drugs, you have a big handful of options here. I want to start with hot or cold pack therapy. What do we need to know about that?
Well, I love hot and cold pack therapy for pets in pain, because these are things that we can get to. We've got ice packs in the freezer. We've got usually the warm packs that are things that we can, you know, put in the microwave and warm up and things like that. But people always wonder, like, do I hot pack it? Do I cold pack it? Or like, maybe I'll just do them both at the same time. You know, which one do I do? Because you've got them both there. Here's the rule of thumb with hot packs and cold packs. Okay, if you're watching a pet and that pet has some sort of an acute injury, like they jump off the couch and then they're holding their paw up, something like this, I can cold pack that. So anything that's acute, that has inflammation and immediate sort of injury, something like that, that's a cold pack. I'm trying to keep inflammation down because this is a new injury. So cold packs, I'm going to obviously wrap them in a towel. I'm going to put them on my own hands. I'm only going to put them on for a minute or two and take it off and feel the skin and make sure this is not, you know, getting too cold, because, you know, pets can't say anything. And sometimes, you know, if you've ever put a cold pack on your own arm, you may know that sometimes it gets a little too cold. So we're going to be wary of that. But I'm going to do 5 to 10 minutes, but just putting on for a minute or two and kind of taking it off and feeling the skin and putting it back on. And I'll do that every couple of hours. That's for an acute problem, a new, fresh injury. For chronic, ongoing problems, right? Like arthritis, hip disease, you know, arthritis in the knees, anything like that, the back, the neck pain, anything like that, I'm going to warm pack that. And so the research is pretty clear here. When I've got ongoing injuries, I can increase functionality and I can decrease pain by bringing, you know, extra blood flow to the area and just sort of increasing the overall sort of, you know, energy level of what's going on there. So I'm going to do that. But again, the same thing. I'm not going to let this thing get too hot. I'm going to test it on myself. I'm going to do sort of shorter intervals. I'm going to feel the skin, and I'm going to apply it every couple of hours as I can. But when you do those sorts of things, that's great. It's, you know, after surgeries, we're going to be doing cold packs because we've got an area that's fresh and, you know, and irritated. And then after maybe we take stitches out or things like that, we may start to hot pack it to try to increase recovery or speed up recovery time.
Yeah, and thank you for everybody saying that you would love another session. We all would. I'd love another session. So let's agree to do this. Whether you're watching live or you're watching the recording, feel free to send us a note, email, tweet, whatever your favorite method of tracking me down, and get me your question, get me a topic, get me a thought, get me something. We will collect these, and then we'll throw them Doctor's way and see what we can put together for everybody in a future session. That would be phenomenal. What else would you like to talk about, Doctor, in terms of pain management without drugs? I know you have a few on here. Which one next would make the most impact of sense?
Oh, geez. Let's think. Just a couple of things. Okay, anxiety is a big thing. I'm a big fear-free guy. Take the pet out of petrified. The research in this is really strong, guys. I'm serious. There is good, solid, strong research that shows that stress and anxiety increase pain pathways and increase pain sensitivity, meaning pets that are that hurt, when they're stressed out, they feel that pain more. And there's also lots of research that shows that pain actually causes physical damage in the brain. It's a scarring process. So pain and stress, they work hand in hand, and I want to decrease stress. And that's, again, cats are very prone to stress and anxiety, especially new people coming in. So I want to pay attention to things I can do to lower the stress, to bring the fear down. And so some of the things that I recommend for pet sitters, familiarize yourself with some of the pheromone sprays. I love Feel Away. There's one for dogs. It's called DAP, or dog appeasing pheromone. One of the brand names is Adaptil. There's other ones that are on the market. You can get collars. You can get diffusers like those Glade plugins that plug into the wall. Those work, and there's good research behind it. It's not just pie in the sky stuff. For somebody like you coming into the house, the pump sprays can be great. I will take the Feel Away spray and spray down my white coat. And then listen, when the first time it comes out, it's sort of an alcohol-based spray. The first 30 minutes is like, it's maybe not super awesome. But after the stuff dries, it does work, and the research is there. So consider that. Spray your bags down, the Feel Away spray or the Adaptil spray for dogs, wherever you're going. But that stuff can be great. Mention to the pet owners, hey, you're going out of town. If you've got some dirty T-shirts or something, maybe I could stick it in your pet's bed. Would that be okay? Shoes or shirts, maybe some socks. You start to get kind of funky. I don't want your underwear. I know the pets will love it, but I don't want that. Maybe just stick with the shirt. But things like that to have the owner's scent that reduces anxiety. For cats, you know, I'm going to try to leave that stuff out in place that they can get, where they sleep, where they spend their time. For dogs, again, in the bed, something like that. But give them something to try to reduce their anxiety, you know, and just spend time with them and just be aware of where they are, especially cats. I'm not going to come busting in to the house and turn on the Lady Gaga, you know, CD and blast it out. Like, we're going to come in slowly. We're going to come in quietly. We're going to be kind of respectful of their space. I'm going to try to bring their anxiety level down, because that can actually help with pain. And so let's see. The one other thing I'll say, if you guys aren't on the acupuncture bandwagon, think seriously about it. There's probably people in your area that are doing acupuncture for pets. If you're aware of those people, you can make recommendations, but acupuncture is fantastic. I love it. It makes a huge difference in some of these chronic patients. And pet owners who are resistant to medical therapy may often buy into acupuncture or things like that. So just be aware.
Wow. I'm floored. We're at the top of the hour. Clearly, we have at least, we only really hit 50%, as if that's not plenty enough. And everybody's saying, yes, do it again, do it again. A few quick things. Dr. Andy is of the Cone of Shame fame on YouTube. He's got a couple of hundred videos at least, all detailing 5-6 minutes of really humorous and educational and insightful videos that are well produced, very funny. He's a great guy. He knows what he's talking about. We'll have the links all close by to subscribe to his Cone of Shame. Check out his Facebook fan page, over 160,000 likes. So you're doing something right. And boy, am I honored that we crossed paths and that you are one of us now, dare I say. Everybody watching, friends and fans and clients and colleagues of Pet Sittingology, you know that if and when you become a client of ours in any regard, you're invited right into our active, supportive, and wonderful Facebook private group. Dr. Andy is there as well, P.S. So if you have questions, head on over, type some stuff up. We'll gather them. We'll talk. We'll keep everything going. I'm so sad we have to end this. What else can we leave you with, Dr. Andy? What's on your mind to usher us off into the sunset?
No, this has been great. Definitely send Josh your questions. I'm always looking for questions. I make these Cone of Shame episodes to try to help you guys. And I do sort of some shorter videos like Ask Dr. Andy, where I just try to tackle a quick question and just put that out there on video. So yeah, share some questions with him, share them with me, and I'll do whatever I can to help you out. I'm here for you. And probably the easiest way to find me, as Josh said, is honestly probably my Facebook page. It's Dr. Andy Roark, and I do a lot of stuff there. So everything else kind of links off of that.
Well, you are phenomenal. I want to thank you. I want to thank everybody for joining us. If I haven't made this clear, which I have, he's going to be with us in Vegas. I cannot believe that. So PetSittingLive.com over the next few weeks to grab your last minute tickets. They're still there. We hope to see you. For now, thank you for joining us, and we'll talk to you soon. Have a great day, everybody.
Thanks, everybody. Thanks a lot.